Okay. Hi, can I come in?
Yes.
All right. Hi, my name is Rosie, and I am going to be your nurse today.
Hi.
Hi, can you go ahead and tell me your name and your date of birth?
Amanda Stetton, 8/20/88.
Excellent. I'm going to check your armband. Thank you very much. All right. Do you have any allergies that I need to know about?
Cefazolin.
Cefazolin. Okay. Are you in any pain today?
No.
No. Okay. Glad to hear that. I'm here to perform a head-to-toe assessment on you. It should take about anywhere from 10 to 15 minutes. Are you okay with that?
Yes.
Okay. If at any time during the assessment, if you don't feel comfortable or if you want me to stop, just let me know and I'll discontinue the assessment.
Okay.
Okay. All right. Can you tell me what the date is?
May 4th, 2026.
Excellent. All right. And do you know where you are?
I'm at the hospital
All right. And do you know why you're here?
to get an assessment.
Okay. So patient is alert and oriented ×4. Go ahead and just check the bed that it's locked. Okay. And I'm going to go ahead and raise the bed just a little bit here for my comfort. Get it up. No. Oh my God. There we go. Okay. All right. Looking at the patient is well groomed. No slurred speech, was able to respond to my questions. Patient seems to be relaxed and seems to be home. Okay, I'm gonna go ahead and I'm gonna start off with your head. Is it okay if I place my hands on your head?
Yes.
Okay, here we go. We're just checking and palpating the head, not noticing any sort of visible masses or any noticeable masses or lumps. Okay, just looking here at the scalp. There's no lesions, there's no presence of head lice. Hair is evenly distributed. Okay, great. Okay, going ahead, just looking at the face. There's no unilateral drooping happening with the face. And skin is appropriate for ethnicity. Okay, I'm gonna have you go ahead and puff out your cheeks for me. Excellent. Okay, you can do this. Great, and go ahead and smile. Excellent, and then I'm gonna have you frown. Oh, okay. Excellent. Okay, and then I'm gonna go ahead and just take a little look here at your ears. Okay, no redness, no swelling, not seeing any noticeable discharge. I'm going to check the other side. Okay, and also looks good. Can you go ahead and cover your left ear with your left hand? Close your eyes. Let me know when you hear something in your right ear.
Yes.
Okay, great. Go ahead and cover your right ear with your right hand. Okay, and do you hear anything in the left?
Yes.
Okay, great. Excellent. Okay, let's see here. Are you having any tingling or numbness in the facial area?
No.
Okay, all right. Go ahead and just check your lymph nodes. All right, palpating lymph nodes here. Not noticing any enlargement or swelling. Okay, great. All right, I'm gonna go ahead and check your nose. I'm gonna shine this little light up into your nose. If you just tilt your head back just a little bit. Okay, patency is good. All right, I'm gonna go ahead and have you just close and you can bring your head back to neutral position. There you go. Can you just go ahead and close one nostril and sniff up the other? Great. Okay, can you do the other side? All right, any issues with that?
No.
Okay, great. Okay, I'm gonna check your eyes.
Okay.
All right. So I'm gonna shine a light into your eyes if you just wanna look straight ahead. All right. Okay. Okay, great. Pupils are equal, round, and reactive to light and accommodation, which is great. Okay. Oh, wait, I still need this. Okay, go ahead and take a look at my pen. You're gonna keep your head still and just follow my pen with your gaze. Lovely. All right, I'm gonna draw the pen towards your nose. Just keep looking at it. Perfect. Okay, I know. Okay. and squeeze your eyes shut for me. Great, go ahead and open them. And then go ahead and squeeze one more time. No, let me open them. Fantastic, okay, wonderful. I'm gonna check your mouth next. Can you go ahead and open your mouth? Just take a look here. Oral mucosa is pink and it's intact. Denture looks good. Tongue is midline. No evidence of sores or lesions in the mouth. Look, I'm gonna have you stick out your tongue. Okay, I'm gonna place this on your tongue. Go ahead and say ah. Excellent. Okay, uvula is midline. I'm gonna place my hands up here. Can you go ahead and open and close your mouth? Great. Okay, and go ahead and move your jaw to the left and then to the right. Awesome. Can you protrude out? Fantastic. Okay, everything is good there. Alrighty. Okay, I'm gonna go ahead and check your neck next. So can you go ahead and drop your chin to your chest? Great. And bring it back up, and then can you come back? Lovely. Trachea looks midline. Okay. Can you bring right ear to right shoulder? Lovely. Left ear to left shoulder. Okay. Excellent. Can you look over the right shoulder? Awesome. And can you look over your left shoulder? Excellent. Bring your head back to center. And I'm just going to have you look over your left shoulder one more time. Just going to check for jugular vein distension, and there is none noted. Let's go ahead and turn your head this direction. No JVD on this side either. Okay, come back to center. All right. I'm going to place my hands on your shoulders here. Go ahead and shrug up against my hands. Okay, drop. Excellent. Okay, strength is symmetrical bilaterally. Okay, I'm going to listen to your carotid. I'm going to clean my stethoscope. All right, I'm just going to start right over here. Oh. It'd help if I did this first. Pulse is normal bilaterally for the carotid. All right. Next, I'm going to go ahead and check your lungs. I'm going to listen to your lungs with my stethoscope. It's going to involve me placing my stethoscope under your gown. Do you feel comfortable with that?
Yes.
Okay. All right. Just going to do this to loosen it just a little bit. Okay, we're going to start up here. Right upper lobe. Taylor, take a deep breath in and out. Okay. Okay. Right middle lobe. Okay. Right lower lobe. All right. We have left upper lobe. And then we do left lower lobe. Okay. I'm going to go ahead and listen to the sides. I'm going to come from this direction. Okay. Go ahead and breathe in. Okay. Great. I'm going to go ahead and listen to the right lateral lung. Okay. Breathe in. Great. And perfect. Okay. Lung sounds are clear bilaterally, also no evidence of wheezing, bronchi, or crackles. I'm going to go ahead and listen to your heart sounds next. Okay. We'll start up here. The aortic, pulmonic, okay. Erb's point, tricuspid, mitral, I'm gonna go ahead and access it from over here. Thank you. Okay, thank you. And then I'm gonna go ahead and just check your, I'm gonna listen to this for 1 full minute while checking the radial pulse. Checking for pulse deficit, which there is no evidence of pulse deficit. Okay, great. Heart sounds, I can hear S1 and S2 heart sounds, and there's no detection of murmurs or gallops. All right, I'm gonna listen to your bowel sounds next and check and inspect your abdomen. So I'm gonna go ahead and just lower the head of the bed a little bit. Okay. And are you okay if I lift your gown to expose your abdomen?
Yes.
Okay. Great. Looking at the abdomen, no visible distension, no visible lumps or masses, no bruising, no erythema or swelling. Skin is intact. Okay, I'm gonna listen to each of the 4 quadrants for 1 full minute. I'm listening for 5 to 34 sounds per quadrant. And left side for 1 full minute. And for 1 full minute. Okay. Vowel sounds are within the 5 to 34 range of sounds. I need to palpate your abdomen before we do that. So I'm gonna go ahead and place my hands here. If you feel any tenderness, let me know. Okay. So far so good?
Yes.
Okay, great. Okay, great. Not feeling any masses or lumps. Okay. I'm also going to check, if you could just bring your hands out this way, I'm just going to check your bilateral or radial pulses here. Great, pulses are equal bilaterally and are 2+. If you can just turn your hands over, I'm going to check your capillary refill. Okay, so that is 2 seconds or less. 2 seconds or less. Okay, fantastic. I'm going to move on down here. We're going to just do a little range of motion checking here. Can you go ahead and move your left leg out to the side? Excellent, bring it back, and then right leg. Great. Can you go ahead and draw your right knee in toward you? Lovely. And how about left knee? Great. Okay, great. Okay, and can you go ahead and circle your ankles? Great. Is there any pain or stiffness when you do this?
No.
Great. Okay, I'm gonna go ahead and check your pedal pulses. Pedal pulses are equal bilaterally and 2+. Okay, I'm gonna check capillary refill here. I'm just gonna go ahead and brush the tops of your toes since you have nail polish on. Okay. Capillary refill is under 2 seconds. Okay, and then I'm going to go ahead and I'm gonna try to push down on your feet, but don't let me. Perfect. Okay, and then don't let me push your feet up towards you. Perfect. Okay, great. All right, I'm gonna have you come sit to the side of the bed, but I'm going to check. Oopsies, wait a minute. Oops, sorry. There we go. Okay, we are in the lowest position. Okay, just wanted to make sure. Thank you. All right. Just looking at patient, noticing anterior thorax. Breath seems to be equal, and lung expansion seems to be normal here. And then I'm going to go ahead and just have you bring your elbows up like so. And before I touch you, I need to change my gloves. Sorry about that, that wasn't yours. All right. I knew something wasn't good. Okay. All right, can you go ahead and bring your elbows up like this? Perfect. Okay, don't let me pull your arms toward me. Excellent. Don't let me push them toward you. Great. Can you just bend your elbows in and out? Lovely. Great. Go ahead and grab onto my hands and squeeze. Awesome. Great. Can you roll your wrists? Any pain or stiffness with any of these movements?
No.
Okay. Excellent. Let's go ahead. And can you bring your arms out to the side? Great. And then down. Can you reach your arms overhead? Great. How about behind you? Great. Excellent. Can you place your hands on your shoulders? Can you just roll your shoulders forward? Great. Okay. Excellent. Okay. I'm going to go ahead now. I'm going to have you stand up. And you can go ahead and just come right over here and you can just face me. Yeah, perfect. Okay, we're just gonna check your balance. Okay, so if you just bring your weight into your right leg, are you able to lift your left foot? Fantastic. And let's go ahead and do the other side. Great, okay. And then I'm gonna have you come toward me just a little bit, and then turn around and then walk towards that wall. Okay, great. Gait looks steady and walking back. Fantastic. Great. Okay, and then can you go ahead and move to the side? Excellent. And then to the other side. Excellent. Then how about coming back? Great. And then leaning forward. Let's help you with your there we go. Okay. All right, and then go ahead and just come forward. Excellent. And then I'm gonna have you just run my fingers here. And do you feel any tenderness with that?
No.
Okay, great. You come back up. Excellent. I'm going to check for your kidneys here. So I'm going to place my hand over, and then I'm going to go ahead and give you a little knock. Any tenderness?
No.
Okay, other side?
No.
Okay, excellent. All right. I am going to have you have another seat on the bed. We are almost done, but I realize that I need to check your thyroid and your posterior lungs. So I'm going to do that right now. In order to check your thyroid, I'm going to have to come behind you and bring my bring my hands to your neck. Do you feel comfortable with that?
Yes.
Okay. Okay. All right, here we go. My hands are coming around. All right, not noticing any unusual lumps or masses. Can you go ahead and take a swallow? Great, thyroid moves freely. Looking at the back, skin is intact, no evidence of bruising or redness. I'm gonna go ahead and listen to your lungs. Okay. Okay, starting with the right side, right upper. Take a deep breath in and out. Great. In and out. In and out. Right lateral lung in. Left upper, great, and then left lower, great, left lateral, fantastic. And then while you're here, I'm gonna go ahead and just place my hands on your back and take a deep breath in and then out. Great, lungs inflate symmetrically, bilaterally, excellent. Okay, wonderful. Okay, I'm gonna go ahead and have you help you get back into bed here. I'm gonna raise the head of the bed just a little bit so that you are more comfortable.
Thank you.
Of course, there we go. Okay, well that concludes our assessment. You have your call light right here, so if you should need anything, just go ahead and click on that and I will come check in on you. I'm checking the space. It is clear. I'm not seeing anything on the floor. Do you need anything before I leave?
No.
Okay, excellent. I will be back in about 30 minutes to check on you then.
Okay.
Okay.
Thank you.
All right. Thank you so much. And hygiene.